Is money trumping safety when it comes to long-term care in Ontario? Well, that's the question several families are asking after we shared the story of a 92-year-old woman who has been assaulted several times at London's Mount Hope facility. Well, now CTV has learned that a different family has had to go to extremes to keep their aggressive and violent father out of a long-term facility and in psychiatric care. Christina Howard joins us with this side of the story. Christina.
Tara, this family doesn't want their father to hurt other people. They say they're being bullied to move their dad back into long-term care, even though he's already assaulted several other residents. Now, we've changed the family and father's names because the father is still receiving care. This is how Paul often goes to sleep, restrained in one way or another because of his history of violence and aggression.
Because he's a potential to hurt people. And himself.
It's something that Paul, who suffers from dementia, has done several times.
He was in a long-term facility in Stouffville, and his behavior had escalated where he was becoming more and more violent.
When he came to London, that violence continued.
He would pull other residents and go into other residents' rooms, and other residents would come into his room. It was kind of, their staffing levels are so minimal that it's impossible to keep track of everybody.
There is no mandated ratio of nurses to patients in long-term care centers. Oftentimes, there's just one nurse for 60 patients.
I think it's a cost thing.
At Mount Hope, Paul's violence escalated, and he and his victim ended up in the hospital. The family had to lobby to keep him out of long-term care.
When they wanted to force him back to the nursing home, I'd had these pictures, and I said, well, as long as you can do that, then he can go back. And they couldn't. They were unable to do that.
Paul has been at the Regional Mental Health Center since 2012, although his family has been approached several times with requests to return him to long-term care. The family believes it all comes down to cost, and when you add up the numbers, it's easy to see why they think that way. The patient cost to the system is at about $107 per day at Mount Hope. At the Regional Mental Health Center, it's over $500 per day. They say the problem will only get worse when this facility closes and the new facility around Parkwood Hospital opens. That's because there'll be about 40% fewer beds, meaning less places for people like their father, aggressive dementia patients with a history of violence against residents. Now in a wheelchair, Paul is still often restrained in a chair like this, which limits his upper body movement.
Absolutely. If he is sent to another facility that's not got the intense supervision that they have at the Regional Mental Health Center, he'll hurt somebody or himself.
Now, in recent weeks, Paul's status has been downgraded to palliative, and since then the family hasn't been approached about a relocation. But they are concerned that other aggressive dementia patients are being pushed into settings that could endanger others. Tara?
Great work the past couple of days, Christina. Thank you.